The second part of Stem15 deals with the final three sub-dot points underneath the healthcare in Australia dot point, and these dot points are healthcare expenditure versus expenditure on early intervention and prevention, the impact of emerging new treatments and technologies on healthcare, and also health insurance, Medicare and private. So we'll look at those three over the course of this presentation. First off, looking at the healthcare expenditure versus expenditure on the early intervention and prevention. That early intervention and prevention is just another term for health promotion. So we're looking at how much do we spend on health care as opposed to how much do we spend on health promotion. And you can see here, these are the totals. And 68% of all health expenditure goes to health care as opposed to 1.8% on health promotion. So it's a pretty significant difference. And you can see there the sort of money we're talking. That was in 2005-2006. Here's the two different types of health expenditure, and you can read through those yourselves. So just looking now at the healthcare expenditure, you can see there's the same numbers again. The federal government contributes the majority of this. The rest comes from state and territory and local governments, and also non-government sector. And this last point here is an interesting point when you think back to the groups experiencing health inequities. One of those was Aboriginal and Torres Strait Islanders. In order to try and address that inequity and change things to improve their health, government has implemented a number of different treatments and healthcare facilities directly aimed at those communities. And you can see that the government is spending 17% more on every Indigenous person than they are on non-Indigenous people in order to address that massive inequity in health status. Here's where the majority of the money is spent. You can see cardiovascular disease here is the most expensive disease group, and that makes sense as that is the #1 killer of all people in Australia across all ages. Just going through the other major causes of expenditure here, you've got mental disorders, cancers, respiratory problems and injuries, which make up 4 of the other 5 priority areas for health. And oral health here, you can see there's only a very small part of oral health that's in hospital, which is the blue bit, the admitted patient services. The majority of that oral health is all out of hospital type stuff that is done. Now, as far as the intervention and prevention goes, preventative preventative health promotion type things are also known as public health interventions. And as you can see here, this is what they focus on, the prevention promotion, rather than just simply treating a problem. They look at what causes a problem and how they can prevent that happening again. And they're very good in theory, these programs, but they do take quite some time before you start to see the results. For example, if we start an anti-smoking campaign now in 2011, the results of that might not be seen in terms of differences in lung cancer for probably another 25-30 years, because lung cancer takes a while to develop. There's a couple of examples of non-government agencies, Cancer Council and Heart Foundation, that are involved in health promotion activities. Here's some data we mentioned before, that only 1.8% of total health expenditure is actually spent on health promotion. If you just looked at that number, that's a massive amount of money, and you'd say we're doing a pretty good job in regards to health promotion. But if you look at it relatively speaking to how much we actually spend on health all up, it's only 1.8%, which is a very, very small amount. And the argument's always been, the question's always been, should we spend more on trying to prevent diseases from occurring as opposed to treating them? And so far the answer from governments, if we look at these last 2 points, is no, we should spend more on the treatment. The governments are saying we need to spend more on the treatment so we can address, or we can treat people who need it right now and in the present, rather than spending money on something that might show some improvement 30 years down the track. Because remember, governments need to be re-elected every 4 years. So they're going to need something. They're going to need to spend their money on something that shows instant results, or results within a year or so, rather than results that may or may not happen in 30 years or so. So it's much more effective for a government to build a new hospital or a new cancer treatment wing in a hospital so people can actually see that, and the government can say they're doing a good job. Moving on to the next dot point, looking at the impact of emerging treatments and technologies on healthcare. Obviously, one of the impacts is that we're spending a lot more money now on healthcare. So the new technologies and treatments don't come cheap. So the impact is that they've caused the amount of money that we spend on healthcare to go up, which is feasible when you think about the fact that there's inflation. But what is concerning is that not only are we spending more money, but the rate of increase of our spending is also going up. So that is a bit of a concern. Because of these new treatments, technologies, another impact is that people, or more and more people are visiting doctors. They're becoming more and more aware. They're having more services available to them, so they go and use them. And because we've got an ageing population as well, they're the people that need the most care. So that's combining, or those two things are also combining to increase the amount of money spent on health care at the moment. We're just having a look at cancer screening and childhood vaccinations in terms of treatments. Cancer screening, you can see here that there's various methods of screening for different types of cancers. These have been highly successful, and it's part of the reason why cancer is increasing in incidence, but it's actually decreasing in mortality, because we're getting onto these cancers, detecting them earlier, thus reducing the amount of pain and suffering of the cancer patient and also the mortality rate. So morbidity and mortality are being decreased by these screening services. In the schools, we've got childhood vaccinations, which again are designed to prevent children suffering morbidity in particular illnesses that affect the younger demographic, and these are some examples of those particular illnesses here. You would have remembered in Year 7, I think, here at school you got vaccinations done. You would have had them done all through primary school. That was courtesy of the government, and again designed to reduce mortality and morbidity. So the impact of the screening, the vaccination programs is summed up here in this slide, and you can read through those yourself. The last dot point looks at health insurance, so the Medicare, which is the public system, up against the private system. So what we need to do, as directed by the syllabus, is look at the advantages and disadvantages of each. Now Medicare is the public system. It was implemented in 1984, as you can see there, and it provides that equal access to all Australians to healthcare, and that's addressing the principle of social justice. It's funded here through taxpayers primarily, and also the government, and there is a couple of other ways that the government hits you with extra surcharges, which we'll look at a bit later on. But you can read through these points. There's also a video we'll watch, which is on PM Online, and you need to watch as well on your own, which explains how Medicare actually works with the rebates and the scheduled fees and all that sort of thing. Now here's the advantages and disadvantages of Medicare. You can read through those yourselves. One thing I'll just make a point of here, one of the advantages I've said of Medicare is it provides equal access to services for all Australians, which is true, it does do that. If you look here at the disadvantage list, I've written the disadvantage is the fact that all Australians have equal access to Medicare. Okay, so why I've written that as a disadvantage is because someone who earns $10 million has the same access to health or to Medicare as someone who earns $50,000. So if that person who earns the $10 million decides to use the public health system, which they're quite entitled to do because it provides equal access to everyone, if they decide to use the public system, that puts a lot of strain on the public system, which means the person who's earning $50,000 who may not have the funds and the means to be a private patient has to wait for surgery and things like that. So, you know, it's not contradicting it, or it sounds like it's contradicting itself, having those two things in completely opposite columns, but it's not, because that's good in theory, providing equal access, but in reality what it actually does is put a lot of strain on the public health system. But like I said, you can read through these advantages and disadvantages of Medicare yourself, and obviously you've put them into your notes. Private health insurance, you see here, primarily funded through private contributions. The government actually also pays 30% of the premiums, and that's something we look at in a couple of slides' time. and you generally split it into hospital cover and general treatment, and also ambulance cover. You might not be aware that ambulances are not covered, so if you ever get an ambulance and you're not privately insured, you'll be hit with a bill in a couple of weeks for that. The advantages and disadvantages of private insurance are here for you to see. One advantage I didn't put in there, that it covers ambulance rides. Disadvantages, just having a look at this one, it's heavily regulated, the private health insurance industry, so all the premiums are the same regardless of what you use, as opposed to the car insurance industry, which is not regulated. So for example, if you drove a car and you had a lot of crashes, you made a lot of claims against your insurer, then your premium would go up in relation to those claims. That's a little bit different in private health insurance. Your premium will be the same whether you use a whole heap of services or whether you don't use too many of the services. So I guess that would be considered a disadvantage, and you can read through these yourself, and obviously we'll have a bit of a chat about them in class 2. Now, what the government has done to try and encourage people to take out private health insurance, there's 3 things that they've done. Like I mentioned before, the government pays, you can see here, 30% of the premiums of private health insurance. So if a premium was $1,000, government would pay $300, you only pay $700. And that's roughly what it is. Most premiums are around about the $750, $800 mark. The second thing the government has done is introduce a thing called the Medicare levy surcharge, which is an extra 1% tax to all Australians if they are not privately insured, if they earn over the surcharge threshold, which is $77,000 for individuals and $154,000 for couples. So you can see here the example. If someone earned $85,000 and didn't have private insurance, they would have to pay an extra 1% of their income, which is $850, when it was tax time. And when you think about it, as I mentioned before, the average premium would be round about $750 to $800. It's actually cheaper to be privately insured than it is to not be privately insured, because whilst you might not be paying your fortnightly or monthly premium through the year, you will be hit for more money at tax time, and that will also be in one big hit, so it might seem a little bit more severe. The third thing the government's done is introduce what they've called the lifetime health cover scheme, which means if you don't have private health insurance at the age of 30 years, if you do choose to take it out later in life, which most people will because their medical needs increase as we get older, as we know, they get hit with a 2% levy on top of whatever their premium is. That's 2% for every year that they have not been insured, on top of whatever the normal premium is. So therefore, if we go to the mathematics side of this, a bit of cross-curricular content, someone who decides to take out health insurance at the age of 50 for the first time, as you can see here, they pay an extra 40%, because 50 minus the original 30 years means they've had 20 years over the age of 30 where they haven't had insurance. So 20 years times 2% per year is 40%, and if the premium was $2,000, which is a fair whack for health insurance, but let's just say it's $2,000, 40% of that $2,000 is $800. Therefore, instead of paying $2,000 like the bloke who's been privately insured from the age of 30 onwards, they would actually have to pay $2,800 for the remainder of their life. Okay, so again, it's not in anyone's financial interests long term to not have private insurance after the age of 30. But like I said, with the Medicare in particular, there is videos we'll be watching in class which will help with your understanding of that. Thanks for listening.